I am Dr. Dibyendu Nandy, practicing general medicine, diabetology, and critical care medicine for last 15 years in the area of Barakpur and periphery of Barakpur. Today, I want to give some lights on diet or effective diet plans for patients with peptic ulcer. We are all in our West Bengal suffering from more or less gastric problems. In West Bengal, especially due to our food habit, basically every Bengalis someday in his or her life suffered from gastric problems, gastric pains, dyspepsia, bloating, etc. Now, I want to focus one thing today, that effective diet plans for us will be very much beneficial. So, let us see. Today, we are discussing a topic that is effective for managing the peptic ulcer disease. Now, what is the peptic ulcer disease? Any disease that causes stomach ulcer, causes pain and bloating and reflux, that is cause peptic ulcer disease. So first, to start, let us understand that peptic ulcer are nothing but sores that form on the lining of the stomach, small intestine, or esophagus, that is also called food pipe, due to the destructive effects of stomach acids. We all know that this acid is very important for digestion of the food, but when it is produced in excess, that cause harm effect also to the intestine and stomach wall. That's why it can cause pain, bloating, vomiting sensation, in some of the cases bleeding also. In two main types of peptic ulcers are gastric ulcer and duodenal ulcer. It is the only the only the position or part of the gastrointestinal tract where it is occurred, that gives it the name. Whether ulcer is in the stomach, it is called stomach ulcer. Whether it is in the duodenum, the latter part of the stomach, it is called duodenal ulcer. Nothing but this. Both can worsen due to stress, certain medication, and also rarely, but it is also happened due to some bacterial infections, particularly Helicobacter pylori. Diet in this scenario plays an important role in managing peptic ulcers. Although food does not directly cause ulcers, but the right dietary choices can soothe the symptoms and support healing the peptic ulcer, while wrong diet or wrong choices can worsen and can increase the discomfort. Here are some nutritional tips and effective meal plans I am giving you who are suffering from peptic ulcers. First of all, it is important to include fiber rich foods in our diet. It is shown in the studies that diets high in fiber, especially from fruits and vegetables, can help reduce the symptoms, and even it can lower the risk of developing ulcer. So, fiber is very important in our diet. Fiber can help by buffering stomach acid, which reduces irritation to the stomach wall or the ulcer site. Foods like oats, apples, carrots, green leafy vegetables are very, very helpful to reduce the stomach acid. They are rich in fiber, vitamins, and minerals also, and they can promote the healing of the ulcer site by generating the mucous membrane, new mucous membrane. Another thing is the probiotic. Probiotic are another beneficial addition in our diet. Probiotics are good bacteria found in foods like yogurt, kefir, fermented foods such as kimchi, etc. This can help to balance gut bacteria and may inhibit the growth of H. pylori and bacteria linked to other peptic ulcer diseases, including a serving of yogurt or a similar fermented product daily can contribute to a healthier gut environment and support ulcer recovery if present. Now, when it comes to the protein sources, lean proteins like chicken and fish are the excellent choices. Red meat and fried foods, we always say to avoid all these protein sources. These are harder to digest and also may cause additional acid production. So, sticking to lean cuts and cooking methods like grilling, baking, and steaming as recommended. It is nothing but the technique of cooking which produces the meal for you which are spicy free. So, non spicy, lean protein sources are always recommended and acceptable for acid peptic disorder or peptic ulcer disease. For those who are vegetarian, tofu and legumes are the excellent protein source which are gentle for the stomach and duodenum. Now we will discuss about some triggering factors. Triggering factors which can cause the peptic ulcer disease to grow, or if it is already present, it will increase the problem. So these are called trigger factors. The trigger foods, that is acidic and spicy foods like citrus foods, tomatoes, chili peppers, these all can worsen ulcers and cause pain to the upper abdomen. Similarly, caffeinated drinks, alcohol, chocolate can stimulate acid production, leading to the discomfort for your abdominal wall. So instead of it, we can choose herbal teas like chamomile or ginger, which can have soothing effects for the stomach and duodenal wall. Another key point is very important, that is our frequency of taking meal. If we can take small frequent meals throughout the day, it will be helpful for stomach and duodenum and easy to digest. Large meals increase the acid production in larger amount and also put stress on the digestive system. So instead of taking larger meal 1 or 2 times a day, taking small meals 5 to 6 times a day can prevent this problem and keep acid levels more stable, reducing the chances of irritation. So last thing I can say, that consider consulting a healthcare provider or dietitian to create a personalized diet plan that fits each individual according to their need and according to their present health condition. So, if we conclude overall discussion, that is, managing a peptic ulcer with the right dietary choices can make a great difference in symptom relief and overall healing. By focusing on fiber, probiotics, lean free products, and avoiding the triggers, individuals with peptic ulcer can enjoy meals while supporting their digestive health. So thank you for listening me and joining with us. Thank you so much. So be conscious and cautious about your diet and dietary habit and enjoy a pain-free life. Thank you.